All right, everyone. Hello. It's really exciting to be invited here today. Like Jonathan said, my name is Dr. Zac Pilossoph. And truth be told, yep, I was sitting on that side of the forum just a year ago. Knew a bit, maybe a couple weeks worth of self-education of what ozone was, and then really got hooked. And so this is basically a testament to what you can do in a year or less time of something you find passion in, and then try to find that in application. Yep, just Jonathan did a good job of introducing me, but 2-minute synopsis. So, graduated vet school, several years ago, maybe about 4 or 5 years ago, and then right away, I've never really fit into the niche of Earth. So, already got excited about finding new. I'm always attracted to new and novel things that maybe haven't been done so much, or maybe have some type of devil's advocacy behind it. So. Cannabis was the first thing that I became acquainted with and fell in love with, and have helped to build that, the belief in that and the trust in it when it's properly curated for medicinal use in our patients. And then ozone was one of the second or third that really fits the bill in the same kind of idea, this adaptogenic property, kind of different than what I do as a vet right now, an adaptogenic vet of different natures. So ozone was very attractive and just very interesting, the ways in which, again, when things seemingly have all these properties that can help in so many different ways, it scares you, because you're like, how is this possible that one source can be beneficial in a numerous or a variety of different conditions and have minimal to no side effects? We're trained the opposite, to use one molecule for one problem and then have a various amount of side effects we have to worry about. So I guess you could say that in the complementary alternative space of veterinary medicine, I saw cannabis as like my nutraceutical, and I saw ozone as almost like my therapeutic that I could use in this adaptogenic form to help patients eventually. So that's really it. And then my application of ozone, after learning about it a little bit, has been in the last few months actually pretty intensively through a couple of practices that I have worked at as a veterinarian. So to just preface that, last thing I'll say is basically as a vet, what I do is I travel across America. I'm a multi-state licensed vet, and I am basically adaptogenic myself. So I fit into ER, GP, critical care practices, things that have, anywhere between 10 to 20 to 30 cases to your normal primary care vet that's seeing, a bunch of appointments a day. So it's been pretty fun. It's been pretty interesting, my young career so far. I'm always looking to learn from others and people that have more experience than me and more wisdom. So that's the only way that I've gotten here so far. And the ozone group has been great for that. It's been really responsive, as well as the veterinarians that I've met that have used it. So that's that. So that's my little intro. And I'm ecstatic to be able to actually be invited to open it today. Like I said, I'm gonna nerd out with you all a little bit, because that's just who I am. So I'm a super nerd. I'm the next generation of super nerds, and I'm happy to be here today, because I think that this is something that I started out as devil's advocate, just like everyone else, not sure really how this worked, and then I realized once again it's just about the right application and using it in the way that's always going to be therapeutic and medicinal, and not abusing that. So my talk going to be is basically just going to get you guys introduced to basically the mechanisms of action, the properties of why this works so many different ways and so many different modalities. So I'm going to talk you through basically the generalities of that, the way in which it interacts with our bodies, and slightly, so I don't step on the toes of the other presenters, but slowly kind of integrate on how it works in certain situations, in pathologic situations. So, all right, let's begin. First, I want everyone to know that we are not the first to be interested in this. Okay, so ozone therapy, not only ozone, the understanding of ozone, but ozone therapy has literally been around since 1856, technically, in terms of using it as a therapeutic multimodal modality. So in 1856, which would give you enough time to realize with that number that they realized that ozone had some type of benefit, whether that was antimicrobial or therapeutic. And so this is exciting because it's new to us today, and we were born only a couple decades ago, but people back in the 1800s knew this was going on, so let's not get so excited, okay? All right. And then what's interesting as well, I think this is pretty cool, everyone knows the name Tesla, so Nikola Tesla, which has got to be some guy from the future with the amount of things that he invented. But in 1896, so again, over a century ago, he invented the first ozone generator. Wasn't specifically for medicinal use, but still, I think that's pretty impressive that, you know, this man from the 1800s, again, knew how to create a machine that could generate this for us, and obviously led to the advancements of where we are today. And then the actual first use of it specifically for medicinal purposes or for therapeutic purposes was actually in World War I. The German army was using it for treating their abscesses, their gangrenous infections, fractures, and then eventually actually started using it in several other ways that I didn't list. But so basically in World War I, you know, again, almost a century ago, ozone was used therapeutically. So again, where this is new to, you know, the 99th percentile of veterinary medicine and maybe the 99th to 98th percentile of human medicine, but people have been knowing about this for a long time. And then finally, Joachim Hansler in the 1970s invented the first kind of generator that would be what we would consider used today in our veterinary practices. Obviously, we've modernized a bit though. So to continue with that, now to kind of explain what exactly did these people realize about ozone. They realized that the influence that ozone has on the body is quite unique, again, in comparison to the things that we've been trained on for the most part. And that is that the qualities or properties of ozone follow this hermetic response. And again, this is a hypothesis. Again, it's something that I think has been used in a lot of different areas throughout medicine, and some of them are applicable and some of them maybe are a little bit far-fetched, but in no doubt, ozone fits the bill in terms of a hormetic agent for the fact that it's the most beneficial when used in an area of where there's low to moderate dosage there versus a high dose that would then be inhibitory or actually harmful to the body. So the hormesis hypothesis basically says that there's this response that you can kind of see of curves or et cetera on a graph that a low to moderate dosage is increasingly beneficial, but then you hit this peak or point where it becomes harmful and it starts to not help your body. And so examples of this that would be communicable would basically be things like moderate exercise or caloric restriction, intermittent fasting, right? If you don't eat forever, you're gonna die. But intermittent fasting has been shown through several mechanisms in human medicine to almost stress your body out a small amount that it upregulates certain genes that help it to actually work at a more efficient rate. Ozone follows the exact same pattern of creating this almost low to moderate dose stress throughout the body, which in actuality helps your cells to upregulate so that they're working more efficiently and that they're not becoming senescent. So again, the conclusion, I guess, that through this hormesis hypothesis in relation to ozone is that essentially at a moderate dose, when we find that moderate therapeutic dose, ozone is able to create a positive metabolic response that enhances the overall physiology. And that's why it scares the crap out of people, because essentially it can help just your cells do its job better. Okay, so next, just to describe a little bit about ozone for everyone who's here for the first time or just trying to catch up. Ozone is a gas. It's what we smell when lightning hits the ground and you kind of smell that weird, almost like chemically smell. It's the generation of an unstable molecule in the face of high energy. And so ozone gas actually is only about 3 to 5% of ozone itself, and then 95 to 97% oxygen when it's applied anyway, even through a generator that's creating a high concentration in general. There's probably ones that maybe don't fit that bill, but for the most part. And then in terms of the molecular behavior, the reason why ozone works is because it has three properties that make it very useful in terms of when we introduce it to the body in a safe manner. The first being that it's a very unstable molecule, meaning that ozone is when you have oxygen, which is stable, which is 2 molecules of oxygen, and you create this third little bond, which is not natural in terms of the environment, which is what creates its interest of going back to its stable form. The second would be that it's a highly reactive molecule, so through this bond that it creates, it has an unequal electron sharing, which again, in nature doesn't like that, so it's going to want to try and go back to the form that is stable in the environment. And then third would be that it's a highly soluble gas in comparison to oxygen. So that comes into play with us because when you use it therapeutically and you introduce it to the body, it's going to be integrated into the biological fluids extremely quickly as compared to oxygen, which is actually going to be carried, and the cells almost have to take a second to figure out how to use it. So ozone as a therapy is basically introducing an unstable form of oxygen to the body and not letting the body give it a chance to think about what it's going to do with it until the form on which of its reactive and unstable state is able to then react with the cellular membranes, et cetera. So, and again, I kind of just went into that here, but and the ways in which some of the more seasoned experts in ozone in human medicine across the world will kind of explain it is that ozone is almost like a prodrug for us, for the mammalian or the multicellular organism. And the reason for that is because it then causes a downstream cascade of events throughout the body that the body can then use and find an ultimate result, versus it being a molecule in and of itself that it introduced to the body for it to do an exact function right then and there. However, what's interesting, this was never mentioned, but I thought of this actually when I was researching this, and I said, but in actuality, it's not really a prodrug for everyone, because when we're using it for other purposes, such as antimicrobial, or what we'll talk about in terms of the pulmonary effects, which is kind of the main downside or adverse effect that people become scared with when they talk about ozone. It's not a prodrug in that situation. It's a direct attack on those cells that are there. And again, we'll talk about this more, but just something to keep in mind that the prodrug is almost like a analogy, but in reality, it's really actually having a direct influence. It's just the way in which it works. So, all right, so now it's starting to get into more of the mechanistic aspect of it when you're using it therapeutically. Important thing to know is that when we're using ozone, especially in a major autohemotherapy form, or we're using it in a form that's going to be introduced systemically, the actual ozone molecule is not doing the direct job that it may sound like it is. We're not putting this unstable reactive molecule and putting it into our cell and saying, now go do the work, okay? So what ozone does is it actually is going to interact, like I said, with the biological fluids and create this cascade of reactions throughout the body that then those molecules that your body uses in reaction to that then can go do a multi-diverse list of jobs and cause a beneficial response. So, and again, this all is surrounding the word safely, okay? Because if you search ozone online, again, you're going to get the squeaky wheels that are scared out of their mind that heard the scary story that killed, 4 to 5 people because someone did something stupid, okay? And obviously science is oftentimes advanced through people doing experimentation and figuring something out, and it works this way and it doesn't work this way. But to only harp on the few instances where it hurts someone versus the thousands and thousands of ways in which it helps someone, again, it's just the squeaky wheel on the other side of the argument. But we have to realize that with any type of new modality and things that we are trying to introduce into something that maybe hasn't been tested by the big guns or the FDAs or the government, that of course there's going to be, in most situations, a right way to do it and then a smaller wrong way to use it. And we have to use everything safely in the manner that is going to be beneficial. So I already said this part here where it causes a cascade. And then I'm sure there are more that happen from people doing things. But basically the scare in which comes with ozone a lot of the time, outside of the pulmonary effects that I'll mention a little bit later, is that through the ways in which they were trying to introduce it to the body, a lot of people were, well, not a lot, but some people were trying to inject the gas directly into the bloodstream versus doing the mechanisms or the first steps that I'm sure that the other presenters today will talk about when using it systemically. So the main scare came, again, like I said, the pulmonary effects that we'll talk about, and then this was really where it came. We don't want to be injecting bubbles of gas into our body. It doesn't work. All right, so I'm going to, from here on out, I'm going to talk very nerdy and sciencey. Like I said, it's what I like to do, but at the same time, I provided a lot of pictures for us to then talk about afterwards, because pictures are beautiful and can say 1,000 words, as the colloquial phrase would go. So this is a very comprehensive picture of basically how ozone works throughout the body. And again, we're going to talk about all of it, but if we we depict a cell membrane, phospholipid bilayer. Once the ozone hits that layer, as you can see here, there's going to be another reaction. We'll see it in a minute, but once it hits this layer, this is not ozone, all right? This is hydrogen peroxide. So the ozone is not getting into the cell. And all these cascades of events you're seeing here, it's not ozone, okay? Ozone is the stimulus, and then your body does the rest of the job, okay? So there's numerous complexes, there's numerous reactions that have to occur, enzymatic reactions, but ultimately what I want this slide to show is that ozone stimulates your body to do all these beneficial things, okay? That's what you got to get out of this. All right, so in general, the mechanism of action, how ozone truly works, is that, again, as we mentioned before, it's a soluble gas. It's 10 times more soluble than oxygen itself. When it is introduced into a biological fluid, it creates an initial reaction with that fluid, as well as if there is a component that the red blood cells can, if it's a thin layer, it can kind of react with their cell membranes right away. The freely circulating reactive molecules, the first molecules to form are antioxidants, in which, again, ozone is a little bit unstable, so it scares the body, and the antioxidant properties, which are circulating, you have millions of them in your body that I'll list later. They are the ones, here, the three main ones actually I listed here, four main ones. They right away help to kind of quench the initial kind of shock that your body has. And again, this is a good shock. It's a shock that tells your body to basically wake up, let's start upregulating some things that are going to keep us healthy and reactive to the world. The initial reaction is that our antioxidants that are floating or circulating around help to neutralize any type of unstable response. So that right away allows the body to use ozone safely. So 20 to 40% on the initial introduction of ozone, basically, of those antioxidants are quenched, leaving then an ability for the body to then use the downstream effects. The remaining ozone there then reacts with polyunsaturated fatty acids, both in the cell membranes as well as in the biological fluids, and then through that will then create the molecules that create the downstream cascade effect, which is basically going to be hydrogen peroxide, and LOPs, which is basically lipid oxygenation or ozonation products. You'll see both words in the literature, so I kind of listed both here. All right, so this is basically this is it. This is how it works. It's stimulating your body through this unstable nature to create molecules throughout the body that then can tell the rest of the body to do its job. So the body is being upregulated. The ozone is not directly being used as a molecule of therapy. All right, I'm going to preface every slide pretty much throughout this, again, with using acceptable ranges, which the other presenters will talk about that later, but this is all the things I talk about are through acceptable therapeutic ranges. All right, so once we have that initial response where the ozone promotes the development of hydrogen peroxide and LOPs, what happens next? The first to be used up is the hydrogen peroxide. So what happens is once that's created, the circulating erythrocytes or red blood cells take up that hydrogen peroxide because it's actually a neutral molecule, and it goes inside the cell. And I just list this here because, again, in literature, I always like to talk about the naysayers. So people will say that it causes red blood cell hemolysis. That's in vitro if it's actually significant. So you'll read that some places, but in a petri dish, it causes hemolysis if it's allowed to sit there long enough, as hydrogen peroxide would. In your body has multiple protective mechanisms, so we don't have to worry about that. So then once it gets in there, again, like I said, the glutathione helps to protect the body against the intracellular reactivity. The effect on the red blood cell itself is how then we have that aura around ozone for creating this euphoric response when you do get ozone therapy as a human. Animals can't really explain that, but in humans, when they get ozone therapy, a lot of times, 80% or more will say that they feel lighter and they feel euphoric basically afterwards. And the reason for that is first that basically the generation of ATP throughout the red blood cells and the transport of then oxygen to your cells is upregulated instantaneously through the influence of ozone indirectly. And so glycolysis, obviously red blood cells have a limited ability to create ATP, but glycolysis is used very efficiently in red blood cells, and right away through the PFK enzyme upregulation, ATP is produced. So you immediately have increased energy throughout your body. And additionally to that, the pentose phosphate pathway, the hexose monophosphate pathway, which is something we've learned back yonder, Yeah, essentially what this is it's an alternative pathway throughout your body, which is used to increase the oxygenation properties and a couple of other things that aren't relevant here. But why we are interested in it is that through the upregulation of G6-PDH, 2,3-DPG levels are increased as well, which then promotes a right shift in the Boer effect, which, long story short, means that heme releases oxygen more efficiently and gives it to your cells and it's at its end site easier. All right, so you're not only creating more energy, but you're also helping to give oxygen to the peripheral tissues so that they can create energy as well. And then a couple other things which I list down here. The first thing is that not only red blood cells do they think red blood cells react with the ozone efficiently, but both white blood cells, different types, neutrophils and lymphocytes, as well as platelets. Platelets we'll talk about a little later, also have this response to the downstream cascades of ozone. And their thoughts, as we'll talk a bit in a minute about them creating an anti-inflammatory response, an analgesic response, and immunomodulatory response, is through the influence to create a certain number of chemokines and cytokines that will result in a positive response throughout the body versus causing a negative pro-inflammatory reaction. And so the mechanism of action for these cells, though, I'm going to present to you things I think that are very mimicable across time of studies. So there's a lot of people that are always obviously advancing it, advancing medicine in multiple ways. So I like to list things that are definitively shown through proof, and then things that I think that are going to be true in a couple years or so, once we kind of understand it more. But I always like to list things, at least I think, that are on the horizon. So we're not sure, I think, if we understand the mechanism of action so far for how lymphocytes and how neutrophils are consistently creating this moderate stress response versus an over response, for the fact that if you look in certain tissues, sometimes it activates different pathways versus others. But long story short is that we have proof that it creates a beneficial response a beneficial inflammatory response versus it being harmful in the majority of situations. The last thing I'll mention here is that there's also this thought that once you administer ozone consistently over weeks to months, that it has enough of a buildup in terms of the anti-inflammatory and antioxidant response that it can then actually permeate and influence your red blood cells that are being created by cells within the bone marrow. So this super gifted erythrocytes hypothesis is something where, again, there's that euphoric state, and then in the initial term, but they actually believe that over time, you're actually stimulating the bone marrow to create more efficient red blood cells. So again, that's something that's pretty unique. I only saw that in a couple of papers I read, one or two of them, but it seems pretty interesting if that's actually true. That again, that takes consistency, and that's something where the body has to be at this level of upregulation for a while, but then the ability to actually affect gene transcription and translation of red blood cells to be more efficient from the get-go, I think that's pretty cool, and if we can start proving that, that would be amazing. All right, so again, like I said, I'm going to follow everything up with a picture of everything I talk about. So this is specifically the reaction with hydrogen peroxide after ozone is introduced into the cell. So we see it here that develops. This is the polyunsaturated fatty acids that I mentioned quickly before that act as the reactor to create hydrogen peroxide, which then through this cascade of oxidative and reductive pathways influences G6PD over here, influencing the development of glycolysis and then the 2,3-DPG phosphate pathway. So just follow this and you'll know everything. Woo! That's all you need to know. Just print out pictures and just be like, this is all you got to know. That's how it works. All right. Next is the other side of the picture. So like I said before, the hydrogen peroxide is the first molecule that's created through the body. The other group is these LOPs, or these oxygenation or ozonation products. And so the LOPs are a group of molecules that actually in most situations are harmful to the body technically, and your body then again is forced to upregulate in a controlled manner to control these LOPs and then use them as actually signaling molecules. So most of these molecules are alkenols. The one that you'll see mostly in the literature right now is 4-HNE, but there are numerous others. And basically what the body does is once these are created through the polyunsaturated fatty acid reaction that the ozone creates, they have to figure out what to do with it. So it basically tells your body to become intelligent, smart, and figure out what to do with these potentially toxic substances. And the body has more than enough regulatory pathways in order to control this reaction. So they'll either, in the initial instance, be bound to albumin or to glutathione, which is, again, an antioxidant that circulates throughout your body, and then react with cell membranes as a compound. This is just a depiction of that. Downstream effects. Initially, the reaction that you'll have is actually through endothelial cells, obviously because this is happening in the biological fluids. So endothelial cells, specifically the second response after the ATP generation in your red blood cells, is that it will have a nitric oxide and or carbon monoxide release throughout the body, which creates the second most talked about in literature, the second most influential effect of ozone, which is peripheral vasodilation, which complements the oxygenation properties we just talked about. So if there's anything that ozone is beneficial for, it's basically at first, number one, bringing oxygenation and energy to your peripheral tissues. And that is proven through the red blood cell reaction as well as this right here, where we have this microvascular dilation directly in response to just the ozone created polyunsaturated fatty acids bind to molecules. In addition to that, then the alkenols will be brought to cells to be brought in through facilitated diffusion intracellularly. And then within that, that's where now we have this really amazing, to me at least, really amazing moderate inflammatory response, which the body's smart enough to say, oh, this is not too big of a deal. Let's create antioxidants versus let's just be freaked out and create pro-inflammatory reactions. And so that downstream pathway is called the NRF2 pathway. NRF2 just stands for nuclear reactor factor protein 2, and it's weird acronyms to everything, but it's basically just a signaling molecule that floats around in the cytoplasm of the cell. It's usually bound to this KEAP1 molecule and creates a complex, and when the alkenols get in, NRF2 is released, and then it can go into the nucleus and affect gene transcription and translation. I guess basically, long story short, NRF2 it is the molecule which is creating this moderate stress response, telling your cells to wake up and let's start doing some jobs. This is just, again, I like to draw things out because it helps me to think in my head how it works. So once NRF2 is released, it binds, instead of KEAP1, it binds to MAP1 and creates antioxidant response elements. And then this list right here is everything that then goes to do the function of the body. So this is the end product, basically, of what I mentioned before about ozone creating a cascade of events that then the body can use beneficially throughout the body, throughout the different tissues and organs. And so superoxide dismutase, glutathione, a bunch of others, catalase, heat shock proteins, hemoxygen 1, heat shock protein, this was supposed to be 70, and this was supposed to be, whoops, missed the number there. And then this one's like nitroquinidone, phase 2 enzymes. It's just ridiculous. It's insane. So once I learned this, I was like, what the heck, man? Like, how is this possible? And then this is when my devil's advocacy turned into full-on believer. So started with the physiology, and then after that, I'm like, all right, let's figure out how we can use this in real life. But just to realize that one molecule of an unstable gas can then promote all of this in your body that then the body can use at will for whatever is needed, that's how ozone is an adaptogenic multimodal modality. Okay, and then, yep, like I said, what does this really communicate to? It communicates to all of this. So it's anti-inflammatory, antioxidant, it's immunomodulatory, it's analgesic, it's vasodilatory, it's neuroprotective. It does this on a regular basis when it's used consistently therapeutically. And it's used in the ratio in which your body needs it. It's not going to be something that is going to be wasted or is going to be in excess if you use it in the proper, again, in the proper concentration. In conjunction with this, the three here that I mentioned one before, the euphoric feeling, again, whether it is due to the increased ATP or release of oxygen in the tissues peripherally, or if it actually does have some type of hormonal excretion or serotonin endorphin influence, again, possible. I haven't found consistent results consistent papers with that yet, for sure, but I have seen several papers, so I think that it's something that people are heavily researching. And then the two that, again, the black box talks. I don't know why cancer is such a black box talks to me, and maybe I'm just too young still, but everyone's scared of cancer, and I just don't get it. So, but the anti-apoptotic and anti-neoplastic discussion, it is a discussion in ozone for the fact that there's no doubt that ozone through its mechanisms is almost like an anti-aging property, essentially, and that's actually how Western medicine used it selfishly at first. Is that the best of the best went to Beverly Hills and were injecting it, and they were living forever. You see these 90-year-old people that look like they're 35. I was like, how is this happening? Well, I figured out that ozone is actually one of them. So there you go. A little side note. But at the same time, in our bodies and our patients, it has an anti-apoptotic DNA repair, protein repair upregulation, and this is through heat shock proteins, including heme oxygen 1, as well as the ability to create an antioxidant effect in general. And what that translates to is cellular longevity. So cells are always breaking down. They are denaturing the proteins inside of them. The telomeres are being shortened, so ozone has the ability to delay that, actually. And then the anti-neoplastic effect, this is a discussion of the future. So again, everyone wants to figure out how to stop cancer because, in a way, cancer is the other side of what ozone is doing. Ozone's upregulating your body to be healthy, and cancer is the upregulation of cells that are unhealthy. And they're just doing jobs that they're not listening to the master regulatory system. So the anti-neoplastic effects, I definitely am a believer that it has anti-neoplastic effects when used systemically. The controversy right now is when it's used as a targeted approach directly into tumors because of the fact that it upregulates the cells. So some people will say that the inflammatory response is actually telling the tumor cells to work more efficiently, and some people will say that it's telling the normal cells within that population of tumor cells to work more efficiently. So I don't know if we know about in terms of targeting and putting it directly into tumors yet. I do know that there are a lot of people that have successfully treated tumors with ozone directly as well as systemically. So I've never studied what happened to the cells inside those tumors themselves. But I have seen it be successful, and then I have research which is saying maybe it's conflicting. So I'm not sure if I have the best opinion on that yet. Okay, another picture, beautiful, tells everything that I just said, that I babbled about in a second or less. But again, this is the reaction here, where we have the balance of your moderate stress response and your overactive stress response. And so the NRF2 pathway here goes down, creates all these molecules. You have anti-neoplastic, and you have then this other side, which is what we'll talk about in a second, which is the NFKB pathway, which is your excessive oxidative response or your excessive inflammatory response throughout the body, which is the promoter of pain, inflammation, and then potentially autoimmune, immune-mediated, as well as neoplastic conditions. So these are always in balance here, and whichever one your cell is deciding to translate through proteins is dependent on the environment. All right, so now I'm going to switch a little bit and say, okay, now that we know these weird numbers and letters and acronyms, how do we actually apply this to the direct tissues or the pathologies that we're going to see? And again, I'm not going to get into like how you actually integrate this into the body, because that's going to be talked about at length by the other presenters who are equally, if not more, useful in the application than I am. But I still want to talk about when you're considering this for certain purposes, then how exactly is this working at this location? So the first that I think that is beneficial to most of, if not all of us, is your musculoskeletal conditions. So dogs are living longer nowadays. They're getting arthritis, and they're getting back pain. They're breaking down. Their tendons and ligaments are getting sore. How is this going to be beneficial? Well, ozone is fantastic for including in your longevity protocol for geriatric patients. Ozonated saline, prolozone, ozonated oils are ways in which you can use it. There's multiple applications. And so the ozone reactivity with the non-hematologic fluids, which would be in conjunction with what we just talked about, is also something we need to consider as a very beneficial modality. And when I say non-hematologic fluids, I mean basically your joints is where we can use this not only systemically, but as a local therapy. So the moderate stress response that we see here, again, in those fluids can also be used in the localized form of when you are introducing it into joints, whether it is systemically or if you are doing it locally as a joint injection. But essentially, when you are going to include this in, if you are going to include this in a therapy for older animals, then, you know, like I said, osteoarthritis is a perfect example of how this can be used, for the fact that the local immune cells, as well as endothelial cells, synovial cells, stem cells, every type of cell that's in the joint environment or the relationship has a really positive reaction to ozone when it's used properly, in addition to maybe some ancillary and complementary therapies that can go with it. So the ratio, like we talked about before, the cell mediator reaction, cytokine reaction, the pro to anti-inflammatory ratio, it's favorable once the ozone is introduced in there and the downstream effects can occur. So like we just mentioned, the NF-κB pathway is inhibited. You're not creating the TNF alphas, the interferons, the interleukin 1Bs, the prostaglandins, and the COX levels at the ratio of what's been happening. Yes? 5 minutes. Okay, perfect. Great. It's not happening at the level of what's been going on for weeks to months to years. Joints are painful, joints are inflamed, and joints are degrading. So ozone has a direct ability to neutralize and or even reverse some of those pathways. It's anti-inflammatory, analgesic, antioxidant, anti-catabolic, et cetera. And through actually, like I mentioned before, the activation of the endothelial cells and the platelets can promote pro-anabolic and pro-tissue repair through the upregulation of the cytokines right here, specifically PDGF and VEGF. So long story short, it helps actually in a way to not only neutralize the degradation of joints, but even maybe helps the body with whatever mechanisms it has left. That's why I put them in parentheses here, as possible. But if a joint is salvageable, it actually may be able to help build it back as a multimodal therapy. Simpler picture than the other ones, but the NF-κB is why I put it on this one. Next would be neuromuscular applications. So again, same type of thought process of how to present. We don't have fibromyalgia in animals that we know of yet, but major autohemotherapy is used actually in humans now from fibromyalgia therapy in certain countries. But again, this is a similar type of thought, but this is actually going to be in a neuromuscular form. So again, not in America really, but in other countries. Ozone is used as a therapy for intravertebral disc disease locally. They actually, through CT-guided applications, are finding very much success in injecting ozone into the nucleus pulposus of extruded and of protruding discs, and being able to shrink that nucleus pulposus and remove a lot of the compression of the spinal cords. I'm not saying that we should all be just doing that right now, just starting it. I'm just saying that this is pretty interesting, and I think that that's at least something I'm interested in maybe helping out with the future. I think that'd be great. But at the same time, paravertebral injections in the muscles around there actually has multiple mechanisms as well to help. Again, not only by decreasing the pro-inflammatory response, but actually it's been shown to almost dull or hyperstimulate and then dull C nociceptors, which are your kind of like your low-grade agonizing pains that you have from chronic inflammation that then activate these free nerve endings. It actually has been shown to almost shock them and then create this really profound analgesic response and muscle relaxation. So this is something that's very interesting. Again, it might have to be done under sedation in animals because it does initially kind of sting from what it sounds like. So again, it's something that might be interesting, but I think through the right proper training, this is something that may be really beneficial, especially if people can't afford a $7,000 to $12,000 back surgery. And then topical applications, something really great as well. I think that we can use in every practice, whether you're primary care, ER, or critical, or anything. Ozone topically is fantastic, not only because of the fact that it's a direct disinfectant. As I mentioned before, for these guys, it's not a prodrug. It's killing them very quickly. So these guys, we don't want it to be a prodrug type form. It directly causes a negative response and a disruption of the phospholipid bilayers of monocellular organisms and then more simple fungi, as well as then in viruses, because viruses are the bane of our existence as humans, because we haven't found direct cures for them yet. It actually can help with capsid oxidation and disrupt virus adhesion mechanisms, thus being actually an antiviral property. And then in conjunction with everything we mentioned before, it's also it promotes tissue healing as well. The one thing about this is that make sure you have to clean the surfaces if you can beforehand, because of the fact that the ozone has to be able to get to the cell membrane layer, so you should flush in. No better thing to clean with than ozonated saline or hydrogen peroxide. That's a simple depiction there. I'm going to skip oral cavity, not because I want to, but essentially I want to finish up so I can get to the last slide. But oral cavity applications, very similar to the topical applications, except for this one thing right here, which is pretty cool. That it's actually been thought that through when you follow it up with a mineralizing agent, that ozone therapy applied to the oral cavity can actually help harden teeth and actually create an analgesic response for the fact that it promotes the dilation of, I put it on here somewhere, exposes the dentin and promotes dentinal tubule dilation, and then followed by a mineralizing agent causes those nerves to contract into the teeth and then can be remineralized over. So this is something that if there's anywhere that ozone, and I'm skipping unfortunately because of time, but this is an amazing area for us to start including in veterinary medicine, is in dental applications. We've already talked about all the antimicrobial aspects, and then to also help with tooth pain, which again I see so much is beneficial. This is the last slide, so I'm going to quickly mention why ozone is scary as anything to people, even if they're not injecting it into their bloodstream directly, is because in the lungs, your body does not have the same protective mechanisms and antioxidant properties as in the blood. So one thing we have to remember when we are including ozone in our therapies, in the practice, if we're training owners to do that at home, is that in the lungs, it can be potentially harmful. For the fact that when it does create this downstream effect of polyunsaturated fatty acids in the alveolar lung lining, the aldehydes, alkenols, hydrogen peroxide that are created, they don't have the antioxidants there to stop it. So it does then cause an NF-κB pathway reaction, upregulates your immune cells there, and then does create actually a pro-inflammatory response that may be in the relationship that would be harmful rather than helpful. So this is just what we have to come with. Everything that we use therapeutically has a benefit and then has to be something you have to worry about. Pulmonary effects, it's not if you breathe a little bit in that you're going to die. The animal's not going to die, but it's something that has to be cognitive of when we're thinking about using this as a therapy option. All right, and like I said, basically unbuffered inflammatory response results in rapid pulmonary inflammation, irritation, and then hurts the body there. But again, that's the fruits of what we can, that's the balance of life. So, all right, that's basically all I got. I know Jonathan wants to move on, so I really hope you appreciate that. Like I said, a lot of nerdy stuff and a lot of science, but starting with the physiology is how we then understand how to use it mechanistically and beneficially throughout our patients. So hopefully that's helpful, and I really appreciate everything, again, being invited.
Stay up here.
Okay,
Stay up here. So now what we're going to do is just transition to our Q&A time, okay? And so for those of you, this is distracting for us to look at, but I have to see some of the questions.
That's fine.
So for those of you who are on site, Olivia's going to have a microphone and take it around. What we're probably going to do instead of doing our breakout here is we're just going to spend the next 10 minutes in Q&A, and then we're going to transition into Dr. Siegel's lecture, okay? So we're going to forego the breakout session this time. First question comes to us online, and again, those of you online, there is a Q&A button, so please use that instead of chatting it into the side panel. If you have a question, enter it into the Q&A part and not into the chat part, okay? But the first question is from Dr. O'Leary, and she says, I use a modality that uses light to stimulate endogenous glutathione production. How will that affect systemic ozone application? Any thoughts on that?
Yeah, I would say it'd be complementary. I don't think it's going to antagonize. Your body, like I said, has a huge potential to do more than it's doing right now. You know, the thought or the colloquial phrase, you only use 10% of your brain. Through what I've studied through not only ozone, but through my cannabis, studies and through a bunch of other things that are basically the grouping of what I'm attracted to, what I found is basically adaptogens, which is things that have multi-diverse benefits to your body. The reason why they work is because your body is sitting there at a percentage state of usage and can be upregulated and be used far more than I think that it does if we're just sitting here at stable state. So I wouldn't say or think that it would be antagonistic whatsoever. I would think that it would just be more beneficial, because if you're stimulating glutathione with this, as I mentioned before, there's 7, 8, 9 other mechanisms of antioxidant and anti-inflammatory pathways and properties that can be upregulated through ozone. So I would say it would only be beneficial and helpful.
Okay. Great. So next question from Dr. Broadfoot, who's online. Does ozone have some of the same mechanisms as ascorbic acid?
I guess you could say. I mean, I kind of think I listed one of the slides, one of the initial antioxidants that helps to stop your body from being in shock when ozone is introduced initially was actually ascorbic acid and alpha tocopherol, which is vitamin E. So vitamin C and vitamin E are used, yes, throughout the body, as well as in conjunction with circulating glutathione, and then the buffering and neutralizing properties of albumin itself. Yeah, it does. As long story short, it has the same general properties, but again, ascorbic acid is one molecule that we're using and trying to get a desired effect. Ozone is a stimulatory gas that causes a cascade of events, and that's why I like ozone for that, because ascorbic acid can be used and then it's used up. Ozone has this just radiating peripheral effect that can last for longer and longer times than I think we really even know, especially through that minute point that we discussed about super gifted erythrocytes. Mm-hmm. So I think that ozone is almost like ascorbic acid on steroids for weeks to years.
Huh.
Yeah.
Okay, so there's another question here, but let's look here on site. Anybody have a question here on site? Olivia, up here.
I realize that there are distinctions, but what about the differences between solubilized ozone and direct ozone in applications? Has someone come up with which is better? And like, for example, saline that's ozonated, that should go right out as ozone into the body from the saline. Whereas I've seen a lot of the applications over the last 2 training days with using straight ozone, and I know the dentin is straight ozone, those cups that go over top of that the dentists are using. But do you make distinctions with that when you're studying that, whether it's solubilized or direct ozone?
Yeah, so I think that I'll kind of touch on that a little bit. I definitely know that some of the other presenters are going to be talking at length about kind of that, but to answer the question shortly, I don't think right now we have to be cognizant of it as much as maybe would seem. I'm fully on board with the thought of that if gas ozone was what we're scared of, basically, and that's why certain people die from it, then we should be worried about not mixing it first with a biological fluid to create that cascade prior to introducing to the body. However, what I found through both the research as well as using it almost more actually right now in my clinical practice of working in these clinics that are using ozone, most of them actually use ozonated saline as their route of therapy. And it's really for those cases that are either chronic inflammation, immune-mediated, autoimmune, cancerous processes, that the systemic is like your number one function right away to go to. Other than that, the ozonated saline, it's still going to have that cascade event on the cells in which it reacts with at the molecular layer that you're applying it. So, if we're using it, for example, to flush ears, right? The ears have your endothelial cells, and they have the immune cells, and they have the blood supply there, in which that cascade is just going to happen locally versus systemically before if you are to mix it with blood prior to. So the mechanism happens. It's just a little altered, I guess, from what would be classically described when we were using it through a mixing of blood prior to introduction to the body.
Great. So this next question would mean you have to have done ozone therapy on yourself, but have you personally felt the euphoric effects? Is one of the questions. So.
I can't wait for that day. I've been dying. I have another partner in business who's a physician, and I've been egging him to start doing it on me and get certified in ozone, but I have not yet felt it yet, but I 100%, and I have several reasons to do it. I have chronic traumatic injuries, and I have inflammation in certain sites in joints and other places in necks, so I'll be using it. I will have a first-person experience very soon, but I haven't yet used the euphoric in myself.
So, and I would say that is not always going to happen, just from personal experience, that euphoric effect. I think certain people and pets probably will experience it, and others won't at all. For me personally, I haven't.
Yeah, no, it's from what they say in terms of the Beverly Hills group that uses it for the anti-aging properties. 4 out of 5 people will leave usually with a euphoric feeling. 1 out of 5 actually, another response that humans get. I haven't seen it obviously in animals reported yet that we know of, but 1 out of 5, if the dose is a little higher than that person can take, will actually get a lethargic response. So they'll feel tired afterwards for days, sometimes for days. So again, that's what comes down to really being cognitive of, again, there's a dose response to this. The moderate dose response is used. A lot of these people are going in for 5, 10, 15, 20 ozone treatments in a 2-week period sometimes, trying to basically reverse their senescent state. So I think that their also use is a little different. But when you're using it to try and become 40 when you're 80, I think that the response is going to be different. And that's where a lot of these groups of tired people, it's not every single one of them, but basically first-time users and people that are using it heavy are the ones that show this response of lethargy. And then others, like Jonathan said, some of them don't have this euphoric feeling, but it's just something, I guess, that I thought was cool.
And we have people chatting in, you know, euphoria is real. Dr. Broadfoot says there's a lot of people saying, great job, Zach. So I just wanted you to know that. Really great presentation. Excellent. By a number of people here. But we have time for maybe one more question, or maybe two, depends on how quick you are. Is vitamin C considered a pro-oxidant or antioxidant, and how does it impact effects of the ozone administered to a patient when given concurrently? Is a question online. That's a tough one.
Yeah, I think it's tough. I honestly would say I don't think we have enough research on it yet. I would say that I'm a physiology basis guy, so I look at what both of them are doing, and both of them are kind of working in the same way. Vitamin C in majority of situation is antioxidant. So just the downstream effects it has, it's very similar to a lot of this. But ozone, like I said, the reason why ozone is different than all these other nutraceuticals that we use or these other supplements or vitamins is because ozone is telling your body to do something versus be a direct molecule to effect. So ozone is training your body essentially to upregulate, to use the antioxidant properties it has naturally versus introducing a new substance into the body directly for its use. So I think that my thought is that I'm not going to be able to answer that directly, but I think that what I would see is them working complementary.
Yeah, go ahead.
I just wanted to kind of add to your perspective on that with the vitamin C and the glutathione question that was also raised. Basically from what we've understood from some things with this course and from some training with Schallenberger is that we need to be careful not to be giving things like glutathione and vitamin C in the time just before an ozone treatment, because it can actually counteract the ozone, essentially getting it to the point where it's kind of scavenged before it has a chance to affect the rest of the body. And so, if you're doing that glutathione treatment, they were talking about waiting until after and then using that to continue upregulating it, I think is great. And same thing with the vitamin C, waiting until after giving the ozone. Yeah,
that totally makes sense, as we saw actually before from that one side, because when ozone is initially introduced, it does get neutralized by certain circulating antioxidants, and vitamin C is one of them. So I would 100% say that makes total sense.
If you were going to do those, would you do ozone first and then a vitamin C treatment?
Yeah, right, exactly. I think that would make a lot of sense, because then it would be complementary versus I could see it being antagonistic in that form. Yeah. You're almost neutralizing one with the other. So that makes total sense.
Okay. Does H2O2 have systemic therapeutic applications? Does that apply here?
Kind of does, because I guess it's technically a good question, because when we see hydrogen peroxide work on the skin, it causes this really profound reaction we see. Hydrogen peroxide in the body has less than 1 second half-life. It's actually closer to the half to even less than that. So its ability to do things is very brief. In actuality, like I kind of mentioned, the cells will take it up because it's a neutral molecule, even though it looks kind of crazy and it's unstable, but it's neutral. It will go inside the cells, specifically the red blood cells that we mentioned here, and will be used in a way that it upregulates the cascade of ATP production, specifically glycolysis. So it does have systemic effects, very much so, but it's usually taken up really rapidly. So it doesn't have the ability to permeate into your muscles or into the deep parenchyma of a liver. But the red blood cells and the circulating biological fluids it can react with, it will have a response.
Great. Well, that is all we have time for as far as questions. If you here on site have questions, write them down in a location that you can find them again when we get to the end of the day. There's 3 or 4 questions online that we're not going to get to right now because we ran out of time. But I thank you. That was awesome. I'm going to go home and listen to it a couple times.
You had to, yeah. The amount of time it took me to get between the acronyms.
You packed stuff in there. So I love it, and it's going to be really helpful for a lot of us. So thank you very much. And again, that's it for this lecture. But thank you again.